ओके, हाँ, थैंक यू। हाँ, hello dear students, hope audio video everything is okay. Fine. So can we start the session? Please inform me that everything is fine. Sure. चलो स्टार्ट करते हैं. So hope all the things are good. Please inform me that all the things are perfect. Yes, as I got information, many colleges now started the exam and few colleges are remaining to start the exam. Fine. Yes, Ashley is here. Okay, all perfect. So let's start the session. Audio is little low. I'm checking here. I think everything is perfect from here. Okay, so I will use my louder voice. So let's start our today's session, the palette. Hello dear friends, very warm welcome to all of you at our conceptual brainstorm integrated session of anatomy. Myself Dr. Shrikant Verma. So now today we are going to deal with our palate. Yes, one of the very important topic for our anatomy, for our ENT, for our surgery and the medicine. So 4 subjects integration we are going to do here. Okay. So now we are going to look for this part. This is the special dedicated session for the first MBBS students. Okay, sir. But yes, the students who want to make their theory part strong, because if your theory is strong, if your concept is strong, you can crack each and every kind of the exam pattern. Okay, so all the other students who are not belonging to the first Prof MBBS, yes, they are belonging to the NEET PG, INICT, FMG, USMLE, PLAB, they are also very warm welcome. Okay, but yes, this is the session mainly dedicated for the first Prof exam. Okay, so we are starting this part with this beautiful lines. सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए. हमारे सीने में नहीं तो तुम्हारे सीने में से ही कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. So let's start this session. Sir, what is the our palette? How to write down in exam? As I told you, in your theory exam, you have to write down properly in the point, with the proper heading, with the well label diagram. Yes, sir. With the flow chart, with the clinical. So first definition: partition between nasal cavity and oral cavity. Partition between nasal cavity and oral cavity, that is our palate. Okay, so this is our diagrammatic presentation which we had drawn during our detailed class. So catch here, sir. Yes, you can see this is the quick review bullet trend. Fine, so this is our way how to draw the our face. Now can you see in the our oral cavity there is the our structure tongue. Sir, there is our structure just behind the nose. Sir, this is our nasal cavity. So the partition between the nasal cavity and the oral cavity, sir, this is the palate. Okay, sir. Now the next point, sir, anterior 4/5. Few books are mentioning the anterior 2/3. Yes, that is the our hard palate, and the posterior part which is having the muscles, which is having the soft structure, that is our soft palate. Posterior 1/5. Few textbooks are mentioning the 1/3 also. Yes, so these are the two parts of the palate. Agree everybody? Getting the point? So now we are going to move for the next. We are looking for the parts of the palate. Sir, two parts. What are the parts? How to write down in your theory exam? Yes, proper heading. First, hard palate. What is the definition? Bony partition between the nasal cavity and the oral cavity. What is the definition? Bony partition between the nasal cavity and the oral cavity. Agree, beta? Okay, sir. Now catch. It is formed by. Yes, sir. It is formed by. Sir, it is formed by the our first palatine process of the maxilla. Sir, here is a maxilla. It is giving rise to the palatine process. It is giving rise to the palatine process. Next, horizontal plate of the palatine bone. Yes, behind there is a palatine bone, so it is making the horizontal part. So just try to understand. Yes, lal fool, neela fool, anatomy beautiful. So remember, yes, ₹2 की Pepsi, anatomy sexy. So just see the beauty of the anatomy. This is our, yes, skull. Okay, sir. This is the beautiful skull. So I am going to show you the 3D anatomy, the beautiful anatomy. We are going to look from the lower side. Sir, this is our palate. So in this palate, can you see, sir, here is the our hard palate, which is having the anterior. Yes, you can see the anterior part. This is our anterior. Yes, 4/5. Few books are mentioning the anterior 2/3, and this is the posterior 1/3 part. So can you see this suture, this line is nothing, it is our interpalatine suture, and you can see, sir, this is our interpalatine suture. This is the our, yes, can you see, this is the our, yes, our palatomaxillary suture part. Fine. So this is crossing. Which type of the suture, sir? This is the plain suture which we had seen already. Okay. Now look here further, sir. This is the diagrammatic presentation. Sir, this is our intermaxillary suture. Yes, please correct this one. This is our intermaxillary because the front part is the maxilla. Okay, so please correct this one. This is the intermaxillary suture, and this is our palatine bone. So what you will say, sir? This is our interpalatine suture. Okay, sir. So what should be the name of this part, sir? This is the maxillary suture. This is the palatine bone. This is the maxilla bone. So this is our maxillary suture. Getting the point, beta? What you have to remember, sir? This is the our maxillary bone part. Sir, this is our palatine bone part. Okay, sir. So maxillary and the palatine. So that is our intermaxillary suture, and this is our interpalatine suture. So this line is representing the our, yes, palatomaxillary suture. Yes, it is presenting the our palatomaxillary suture. Getting the point? Now look here. There is a one opening is present on the anterior part just behind the our incisor teeth. हमारे इंसाइडर टाइप के पीछे में एक छोटा सा फोसा है. सर, दिस इज आवर, यस, इंसिसिव फोसा. Okay, sir. Now look on the back side. There is our foramen. Which foramen is present? Sir, greater palatine foramen, and behind it laser palatine foramen. तो आगे की तरफ आपको greater palatine foramen मिलेगा, नीचे की तरफ आपको laser palatine foramen देखने के लिए मिलेगा. Okay, getting the point? Okay, sir. Now try to understand further. Sir, this is our pterygoid humulus, and this is the posterior nasal spine. So catch this one. This is the anterior 2/3. Here is the posterior 1/3. So you will observe the nerve is coming out from the greater palatine foramen. This is the greater palatine nerve, and through the incisive fossa it is going up. Okay, sir. इसने उसे नर्व दिया, वो भी नीचे नर्व देगा. So one nerve is coming from above to the down. Sir, this is our nerve coming from the nose to the palate. So this is a nasopalatine nerve. Getting the point? Okay, sir. So these are the points. Just along the posterior free border there is a one elevation. This elevation is the palatine crest. What is the name, beta? This is our palatine crest. Okay, sir. Now look here, sir. Our hard palate. Yes, it is dividing. It is having the two margin and the two surface. Yes, can you see two margin, sir? Anterior and the lateral margin. Okay, sir. Sir, this is our posterior margin. Fine. And two surface. One is above, another is below. So you can say the two margins, anterolateral margin. Fine, sir. Posterior margin. Okay, sir. The anterolateral margin, there is the attachment of the gums, and posterolateral margin, there is our soft palate. Look here. Again, the beautiful anatomy. Sir, you can see this is the our part of the skull. Okay. So this is the palate. So there is our anterolateral margin. Here is the attachment of what? Here is the attachment of the our tooth gums. Okay. Now you can observe, sir, there is our posterolateral margin. Yes. In this our posterolateral margin, you can see, sir, there is the presence of the soft palate. Soft palate is attached at this part. Okay, sir. After this all, can you observe here further? Yes, sir. Look here. Sir, the superior surface is related with what? Sir, superior surface is related with the nasal cavity. Inferior surface is related with the oral cavity. बिल्कुल रटने की जरूरत नहीं है. Okay, sir. Now look further. Sir, artery of the our hard palate. Short note, greater palatine artery. Very easy. Palate is supplied by palatine artery. This is big. That's a greater palatine. Do you remember we had talked already about the branches of the maxillary artery. So our mnemonic was pig pass. We had seen posterior superior inferior artery, yes, infraorbital artery, greater palatine artery, then our pharyngeal artery, then artery of pterygoid canal, and sphenopalatine artery, which was the our artery of the epistaxis. Already we had discussed. You can see our previous videos. Okay, sir. So the third part of the maxillary artery is here. Vein, pterygoid venous plexus. Break the name. It is the venous bunch, okay, sir, which is around the our pterygoid muscle. What is the name? Pterygoid venous plexus. Now, sir, definitely greater palatine nerve, nasopalatine nerve. So you can see, sir, there is our greater palatine nerve and nasopalatine nerve. Yes, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. सो द नर्व विच आर रिलेटेड एट दिस एरिया, greater palatine and lesser palatine. Simple. Okay. Now look further. Lymphatic. So remember, palate is here. Which lymph node is close? Sub deep cervical lymph node. Sir, there is our pharynx. So behind the pharynx, the lymph node group, retropharyngeal lymph node. So these are the our lymphatic drainage of the, yes, face part. Okay, getting the point? Now look, we are going to talk about our soft palate. Hard palate is not too much important. Yes, for the clinical point of view, for the cleft palate we have to know. Okay, so we had just discussed in a short and sweet way. Now we are going to look the main part, that is our, yes, soft palate. Agree beta? Soft palate. Fine. Okay, sir. So just observe, sir, this is the our oral cavity, upper tooth, lower tooth. So can you see, this is the our hard palate, and here you can see the our uvula and soft palate part. Okay, so this is the our tongue. So try to understand the gap between the lips and the upper lip. This is known as vestibule. Yes, sir, it is known as the vestibule. Okay, sir. So just observe this diagrammatic presentation which we had drawn during our detail class. Sir, this our muscular structure is the tongue. Yes, this is the uvula. Sir, this part is our soft palate, from where uvula is hanging. सॉफ्ट पैलेट से कौन लटकता रहता है? यूवुला. और उसके आगे वाला पार्ट कौन है? हार्ड पैलेट. सो कैन यू सी, देयर इज द आवर फोल्ड ऑफ द म्यूकोजा रनिंग फ्रॉम द पैलेट टू द टंग. So this is known as the palatoglossal fold. What is the name? Yes, this is our palatoglossal fold. नाम को तोड़ो, palato to the tongue. That's a glossal. Yes, it is the fold. So palatoglossal fold. When we will do incision, within it you will see the brown color muscle. That is the palatoglossal muscle. In the similar way, from the palate, one fold of the mucosa is going to the pharynx. So this is the palatopharyngeal fold. What is the name? Palatopharyngeal fold. So remember, when you will cut, you will see one muscle, palatopharyngeal muscle. Very good. Palatoglossal muscle, palatopharyngeal muscle. This is the uvula. So when we will cut the uvula, within it you will see there is the our, yes, brown color muscle known as the musculi uvuli. What is the name? Musculi uvuli. Okay. So what are the different soft palate muscle? Sir, musculi uvuli. Sir, palatoglossal fold. Sir, palatopharyngeal fold. Getting the point? Fine. Okay, sir. Now look, the soft palate. Sir, how you will define during the theory exam? Sir, it is movable. Sir, it is muscular fold. Sir, it is attached to the posterior border of the hard palate. These are the 3 points. Now look, the diagrammatic presentation. Sir, this was the our palate, hard palate, and here is a soft palate. So soft palate is having the 2 border, point wise description. Yes, superior border and this is the inferior border. 2 borders of the soft palate, superior border, inferior border. Now can you see what are the surface? Sir, this is the our entry surface and here is the posterior surface. 2 surfaces. Okay, the entry surface is towards our oral cavity, so this is known as the oral surface, and this part is towards the our oropharynx, nasopharynx, so this is the our pharyngeal surface. So remember the soft palate. Sir, soft palate is having the 2 borders, 2 surface. Soft palate is having the 2 borders, 2 surface. Very beautiful. Okay. Now look for this our next portion. Okay, sir. So we are going to talk about this our next part. Yes. So look here, muscles of the palate. Sir, there is the anteriorly hard palate and posteriorly the soft palate. Okay, sir. So remember, hard palate is hard. Okay, soft palate is soft. Hard palate is hard because there is a no muscle, and soft palate is soft because there are the presence of the 5 muscles. Okay, So here you will see the musculi uvuli, yes, palatoglossal muscle, yes, palatopharyngeus muscle, yes, levator palatini and tensor palatini muscle. So these are our 5 muscle. Yes, I told you already these 3 muscles. One muscle, when it will contract, it will elevate the palate. So that's why this is the levator palatini. One muscle, when it will contract, it will tense the palate. So this is our tensor palatini muscle. So remember levator palatini and tensor palatini. Okay, sir. Now look, these palatine muscles are supplied by, yes sir, these are supplied by our which nerve? So remember, these all muscles are derived by the fourth arch except tensor palatini. Do you remember our embryology correlation? But we already talked, na? So all the muscles of the palate, they are derived from what? Fourth arch except tensor palatini. Okay, sir. So because the fourth arch, that's why the nerve of the fourth arch is vagus nerve. It will supply. And tensor palatini, बोलो बेटा ये किसकी डेरिवेटिव थी? सर टेंसर प्लेटिनी वाज डिराइव्ड फ्रॉम द फर्स्ट आर्च. So nerve of the first arch is the mandibular nerve. Mandibular nerve will supply it. Okay, sir. So try to understand the nerve supply of the our palate as well as pharynx. Sir, this is our esophagus. Upper dilated part of the esophagus is pharynx. Yes. Here is the pharynx inside. Above the pharynx you will see the palate. Correct, sir. So catch these points. Sir, the vagus nerve is running near our GIT. So vagus nerve says, I will give the branch to the pharynx. Okay. But in the pharynx as well as palate, yes, in previous class I told you pharynx is having the 6 muscle, palate is having the 5 muscle. So total 11 muscle. How the vagus nerve alone can supply all the 11 muscle? So it requires help. Who are the friends of the our vagus nerve? So 9th nerve, sir, 11th nerve. Okay. So what is happening? The 11th nerve is also giving the branch. Remember, this is our pharyngeal branch of the, yes, this is the pharyngeal branch of the vagus nerve. Yes, sir. This yellow color is the pharyngeal branch of the vagus nerve. Okay. Pharyngeal branch of the vagus nerve. Now there is the our 11th nerve. This 11th nerve is giving the branch to the pharynx. So this is within the cranial cavity. So it is known as the cranial root of the 11th nerve. Very important. Yes. Catch this point. The vagus nerve, pharyngeal branch plus cranial root of the 11th nerve, they are uniting and making the Veo Accessory Complex. Remember, मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Yes sir. So remember बेटा, मिर्जा गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Just break the name, Veo Accessory Complex. Yes, it is our vagus nerve plus accessory nerve complex. Yes, it is the complex formed by the vagus nerve and accessory nerve. MCQ, which nerve, which root of the accessory nerve? Answer is beta, yes, the cranial root. But what is our spinal root? Can you see? This spinal root, sir, this spinal root, it will go to the our sternocleidomastoid and the trapezius. It will go to the our sternocleidomastoid and the trapezius muscle part. Getting the point? So it is going towards our sternocleidomastoid and then trapezius. So it is supplying this muscle. So cranial root, palate and pharynx. The spinal root, it is supplying the sternocleidomastoid and trapezius. You know, in our recent exams, the question had been asked, one patient is walking and there was the nail injury at the our neck. So there is an injury to the our nerve. So there is a one muscle paralysis and patient is not able to shrug the shoulder. Why? Because the trapezius is responsible for the shrugging of the shoulder. Got the point? Okay, sir. So this is our, yes, sternocleidomastoid and the trapezius part. Now try to understand further. Sir, the 9th nerve, it is also giving one branch to the pharynx. So this is the pharyngeal branch of the glossopharyngeal nerve. Yes. So this all are uniting the Veo Accessory Complex and the pharyngeal plexus. These all are uniting and supplying the pharyngeal muscle as well as palatine muscle. Again, yes, all muscle of the palate and the pharynx supplied by pharyngeal plexus. Yes, sir. Look here. Sir, this is the posterior wall of the pharynx. So these nerves are coming and they are making the bunch of the nerve on the posterior wall of the pharynx. So this bunch of the nerve on the posterior wall of the pharynx known as pharyngeal plexus. Getting the point? Okay, sir. So this is our pharyngeal plexus. So remember, all muscle of the palate and the pharynx, they are supplied by pharyngeal plexus. This is the best answer. If it is not given, you can mark the Veo Accessory Complex. And if it is not given, then you can mark the vagus nerve also. Okay? Except, do you know? Except tensor palatini. Sir, it is a derivative of the which arch? Sir, it is a derivative of the first arch. So it is supplied by the nerve of the first arch. Answer is the our yes mandibular nerve. Okay, sir. Now look, there is the our sensory nerve supply. So general sensation and spatial sensation. Remember, general sensation are pain, temperature, and touch. Okay, sir. Palatine nerves, middle and the posterior, they are supplying the pain, temperature, touch. Yes, these are the branch of the maxillary nerve. Remember, beta, this is our maxilla part. So these are supplied by the maxillary nerve. And here is our glossopharyngeal nerve. Okay. Yes. Spatial sensation, the taste bud are present. So what is the nerve supply? So try to understand. These are our taste bud, and we had seen this all in our previous ganglion topic in the first prof. Okay. So just see, taste from the soft palate. Okay, sir. Soft palate taste bud, they are getting stimulated. Now the impulse is reaching to the laser palatine nerve. Okay. Then it is reaching to the anterior palatine nerve. Okay. Then it is reaching to the our ganglion. Do you remember our ganglion topic? Okay. There are the four parasympathetic ganglion in our head neck face. Already we had seen the otic ganglion, the submandibular ganglion, the pterygopalatine ganglion, as well as you all know, sir, our submandibular ganglion. So it is coming to the our pterygopalatine ganglion, but it is not relaying, na? It is not relaying. It is not stopping here. Yes. So now further it is participating in the our nerve of pterygoid canal. Now the impulse is going to the greater petrosal nerve, then impulse reaches to the geniculate ganglion, then nervous intermedius, then nucleus of tractus arterius. Yes, the nucleus of tractus arterius, NTS, N for 9, T for 10, S for 7. Yes, so this is the formula mnemonic: N for 9, T for 10, S for 7. Yes, sir. So this is our taste pathway. Fine. So in this way, it is carrying the impulse. It is a sensory pathway. One short flow chart for all of you. Also, secretomotor nerve. How there is a secretion from the palatine gland. So this is the motor nerve. So whenever there is a stimulation, yes, we are thinking, we are eating, we are just smelling the food. The tasty food is causing stimulation of the superior salivatory nucleus. Now the impulse is reaching to the our sensory division of the facial nerve. What is the sensory division of the facial nerve? Nervus intermedius. Then impulse is reaching to the geniculate ganglion. Then impulse is reaching to the greater petrosal nerve. Then it is reaching to the deep petrosal nerve. We had already discussed, na, these are our different ganglion topic. So I am not discussing these things here, na. Yes. Now the deep petrosal nerve, it is meeting with our greater petrosal nerve. Yes, both are making the Vidian's nerve. Very important question. Vidian's nerve is nothing. It is a nerve of the pterygoid canal. Then it is relaying into the our pterygopalatine ganglion. Yes, it is relaying. So now there is our emergence of the anteropalatine nerve. Now it is continuing as the laser palatine nerve, and then it is relaying into the glands of the soft palate. So this is the way secretion. Now we are talking about the arteries. Okay, what are the our different arteries? So remember, palate is supplied by palatine artery. So the greater palatine artery. Do you remember again? Pig pass, maxillary artery, third part. We had seen maxillary artery. It is having the three parts: first, second, third. Okay. So do you remember the first part? It was running within the our over the our mandibular part. Second part was running over the muscle mastication, pterygoid part, and third part was entering within the our pterygopalatine fossa. So that was our pterygopalatine part. So it was giving the pig pass. Mnemonic is the pig pass. Yes. Do you remember? P for pharyngeal branch, I for infraorbital, G for greater palatine artery. The greater palatine artery is supplying our palate. Then P for, you can remember the our pterygoid artery. A for, yes, artery of pterygoid canal. This P is our pharyngeal branch, and this S is our, yes, sphenopalatine artery. Sphenopalatine artery, yes, 1P is the posterior superior alveolar artery. So 1P is the posterior superior alveolar artery, this P is the pharyngeal artery. So these are the our branches of the third part of the maxillary artery. Yes, palatine artery, you know one palatine artery which is ascending upside. It is a branch of the facial artery. Again the name is saying, sir, palatine artery. So it is again the same branch. Now, ascending pharyngeal artery. As the name is suggesting, it is ascending upside and supplying the pharynx. So it is the branch of the external carotid artery. Do you remember this ascending pharyngeal artery is the smallest branch? Yes, first branch and only median branch of the our external carotid artery. Yes, sir. Now see, it is giving the our palatine branch. So there is the vein, there is the lymph. So vein, pterygoid venous plexus and tonsillar venous plexus. These are supplying the our veins. Okay. Now see, lymph. So deep cervical lymph node and retropharyngeal lymph nodes are there. Getting the point? So this is the lymphatic drainage. Whatever the lymphatic lymph node which are close, it will drain there. Now clinical, we are talking about the clinical. So pars ventrage. Do you remember in our previous class I told you the pars ventrage? Yes. So just try to understand. In the pharynx I told you, sir, in our body, in our head neck face, sir, this is the our nasal cavity, just behind to it nasopharynx. Oral cavity, just behind to it oropharynx. This is the larynx, so just behind to it laryngopharynx. So during the swallowing process, what happens? The food material is coming and it is going to enter into the our, yes, you can say the laryngopharynx, then it will go to the our, yes, esophagus, but it can go to the nose. So at that time what happens? This soft palate elevates and it blocks the our nasopharynx. So food is never entering in the our nasopharynx. Again, try to understand this one. Pars ventrage, na? Look here, sir, this is our tongue, sir, this is our palate, this is the pharynx. Okay, now the palate is having the one muscle. Which muscle? Sir, palate to the pharynx, one muscle. This is the pharynx, this is the palate. So this muscle is our palatopharyngeus muscle. Okay, sir. So the upper fiber of the palatopharyngeus, it is making one elevation. Yes, sir. This elevation is known as pars ventrage. Muscle inside is known as the pars vent muscle. The muscle within the our pars ventrage is known as the pars vent muscle. Sir, posterior wall of the pharynx. This is making the posterior wall of the pharynx. It is present in the posterior wall of the pharynx. So that is our palatopharyngeal fold. Yes, sir. This is our palatopharyngeal fold. Within each palatopharyngeus muscle is there. What again I want to tell you, sir? This is our palatopharyngeal fold, palatopharyngeus muscle. Look here. Yes, there is our palatopharyngeus muscle. The upper fiber, they are getting thickened and they are making one elevation. So this is our palatopharyngeal. Yes, this is our palatopharyngeus muscle. Upper fibers, they are making the pars ventrage. Within it, pars vent muscle is present. What is the importance? The soft palate will touch this one and it will block the food entry into the our nasopharynx. Okay, sir. So just see the lines from our textbooks. Yes, upper fibers of the palatopharyngeus pass circulatory deep to the mucous membrane of the pharynx. So form a sphincter internal to the superior constrictor. These fiber constitutes the pars vent muscle. On contraction raises a ridge called the pars vent ridge. Okay, where on the posterior wall of the nasopharynx, it is present on the posterior wall of the nasopharynx. When the soft palate is elevated, it comes in contact with the ridge, two together closing the pharyngeal isthmus between the nasopharynx and the oropharynx. So it is closing the pathway of the nose. Okay, sir. So now look further the clinical points, sir. Cleft palate. So you will see in our embryology part, sir, there is a median part of the lip where the 1, 2, 3, 4 incisors are developing. These are developing from the premaxilla, and this is the our, yes, posterior part of the our palate. So sometimes what happens, one part is fusing but another part is not fusing. Yes, sometimes what is happening, half is fusing. Here complete no fusion, na? Here complete no fusion, and here you can see the partial fusion of the soft palate, and here very small part. Okay, so you can see what are the types of the congenital cleft palate. Bilateral complete cleft palate, then unilateral complete cleft palate, only one side, that's why unilateral. Can you see there is a partial midline cleft? Okay, sir. Can you see there is a cleft of the soft palate? Yes, sir. And there is the bifid uvula. So uvula is only bifid. Okay, so these are the clinical point. Now other things, palatine reflex, you will see the palatine reflex. Also you can say gag reflex. So remember, this is the reflex pathway. So receptor, sensory nerve, center, then there is our efferent, and then there is our, yes, effector muscle. So which nerve is participating? Pharyngeal plexus or Veo Accessory Complex or the our, yes, 10th nerve. So these are the parts: pharyngeal plexus, Veo Accessory Complex, and the 10th nerve. Okay. Paralysis of the soft palate. So the soft palate, yes, food or liquid regurgitation into the nose. We are eating the food, but if the soft palate is getting paralyzed, the food content will come into the nose. Voice abnormal and speech problem. Yes, palate is participating in the proper articulation of the word. If palate is abnormal, palatal paralysis is there, yes, palatine cleft palate is there, in that situation no proper speech, palatine arch is disturbed. Yes, you will see this is the our normal palate, but if one side is paralyzed, then there is a deviation of the uvular deviation of the palate you will see. Okay beta, so these are our points regarding the palate. So this was the our comparatively short and sweet topic. Okay, okay, so this is all about our today's palate. Any doubt beta? The most important thing you have to remember the muscles of the palate and the nerve supply. This is very important. Okay, please ask if you are having any doubt. One quick reason: first you have to define the palate definition, then you have to say about the diagrammatic presentation, then we had discussed about the hard palate, its part, its nerve supply. Okay, but hard palate is not too much important. Then yes, one notes for all of you: hard palate, two margins and two surface. Okay sir, and then artery, vein, nose and the lymphatic. Okay sir. Soft palate we had seen diagrammatic presentation. Also remember, between the palatoglossal fold and palatopharyngeal fold there is a presence of the tonsil. Okay sir, and here you can see the soft palate diagrammatic presentation. Yes, muscles of the palate: hard palate and soft palate. Five muscles in the our soft palate, hard palate because it is hard, so no muscle is there. Now the five muscles are there and their no supply is very important. So I told you what is the pharyngeal plexus, what is the Veo accessory complex, very important. Also remember, in the pharyngeal plexus, sympathetic nerves, T1 fiber, they are participating. Okay, and then we had seen our sensory nerve supply, motor nerve supply, artery supply, yes, clinical part, lymphatic drainage, this all. Okay, yes, this is the cleft palate part, we will see in our embryology also. Fine. So if any doubt better, please ask. Any doubt? Any doubt better, please ask. So at the end, few beautiful lines for all of you. Yes. Any doubt better, please ask if any doubt. Palate, pharynx, larynx, we had completed for the first prof. It is very important, na? Yes, any kind of the doubt, please ask. Okay, so thank you very much. All the best for your exam, dear students. Okay, best wishes.